when you're making a decision for patients with metastatic colon cancer, depending on the location of the tumor, you may have to know the molecular testing. Now, I would argue you want to know that right from the beginning, really in everybody, because you want to know if they're microsatellite stable or unstable. Now, the minority are going to be microsatellite unstable, but still you want to know, because that really changes your thinking about everything. And then, if you're a right-sided colon cancer, so over here, it appears, based on all the evidence that we have, is that EGFR therapies aren't really working very well, at least in the frontline space for those patients. So you could argue that if you have a right-sided colon cancer, if you already knew MSI, you don't really need to know RAS and BRAF just yet, but you're going to want to know. But I would argue as soon as you can get that information, the better. Do you wait on a treatment? Well, the only thing I would wait on is I would not give an EGFR therapy to a right-sided tumor or to a left-sided tumor where you don't know RAS and BRAF, because we know that if you have either of those mutations, then in fact the drugs really don't work very well. Now, on the flip side, in a left-sided colon cancer where you've got significant metastatic disease and you want to use an EGFR therapy, knowing that molecular testing is key, and if it's all wild type, then the drugs work really well and maybe better than bevacizumab, for example, in that setting. So it really depends on location and your overall goals and the regimen you're trying to pick for your first-line treatment.